Welcome to Caregiver SOS On Air, presented by the WellMed Charitable Foundation, with nationally known gerontologist Carol Zernial and award-winning veteran broadcaster Ron Aaron. This program provides health, wellness, and other information for caregivers who are vital to the health and well-being of so many people across our country. And now, here are your hosts, Ron Aaron and Carol Zernial.
Well, hello, everybody, and welcome to the award-winning Caregiver SOS On Air. I'm Ron Aaron. Carol Zernial, our co-host, is on special assignment today, and we're delighted to welcome Tina Smith, filling in for Carol, and she's been here many times. Tina is the Senior Director of Caregiver Program Operations at the WellMed Charitable Foundation. She's got a bachelor's degree in psychology. She earned a master's degree in social gerontology, and she's been providing support to family caregivers for more than 30 years. Tina started her career working in the long-term care industry and then moving on to serve in the Bear Agency on Aging. And Tina, it is great to have you with us.
Oh, thank you, Ron. I always enjoy my time with you and here on SOS On Air.
Well, you do a great job. And what's interesting to me is our topic for this show is language of care, making dementia communication easier than ever. And I know you deal with a lot of caregivers who are trying to help people with dementia.
We do, and because it's such a big job and it's a tough disease to manage, and so a lot of people have questions. Communication is one of the first things to go for somebody with dementia. So learning a new technique and how to best do that, I'm looking forward to hearing about that today.
Well, we're delighted to welcome Dr. Ethelle Lorde. Dr. Lorde is the founding president of the International Caregivers Association. She earned a Master's of Education in Counseling from the University of Maine in Orono in 1992, earned her Doctor of Management in Organizational Leadership, I can use some of that, from the University of Phoenix in 2010. She is an author, a professor, and a keynote speaker, and she's married to the late Major Larry Potter, who was officially diagnosed with vascular dementia in 2000. Her latest book, Alzheimer's and Dementia Coaching, taking a systems approach to creating an Alzheimer's dementia-friendly healthcare workforce. And Dr. Lorde, thank you for being with us.
Well, thank you. I'm pleased to be here, and I'm happy that you invited me.
Now, did you serve as a primary caregiver for your husband?
Yes, for 21 years.
Only 21 years?
Only 21 years.
How challenging was that?
Very. Extremely challenging. As Tina Smith just mentioned, it's one of the most challenging life event that anybody can have, because it's 24/7, and I don't know anybody that can do 24/7 forever.
And tell us a little bit about vascular dementia.
Well, vascular dementia has to do with the heart. Sometimes blood pressure, depression, extra weight, all these things contribute to possibility of developing vascular dementia. It's usually slow progressing, and I noticed that the difference is between high IQ and low IQ. A person with low IQ doesn't seem to be living as long as the one with high IQ, and that's because they figure ways of going around and explaining events in their life. And it's very difficult for us to figure out, is that dementia or not?
And one of the challenges that you obviously have tackled is communication with someone with dementia.
Yes. Would you repeat that?
Well, in working with someone with dementia, communication becomes a challenge.
It's number one. It's number one. And so I say, if you don't know how to handle communication, it's difficult to jump to number 2 or 3 or 4 and think that you're doing a good job. So communication is very important. I was able to create that based on the experience of using transactional analysis in my work forever, since 1992, when I was introduced to transactional analysis. I used that in mental health. I used that in management. And then I said, there is something there that I can use for dementia.
And what did you create?
Well, for example, in mental health, when somebody forms a symbiosis with someone, or their ego states are contaminated, the task is to decontaminate and separate so that they can coexist but not form a symbiosis, be codependent on someone else. In dementia, it's the opposite. It's very important to form that relationship that's authentic, has to be authentic, and the person doing the care must be willing also to form that symbiosis to make really good decisions with that person.
So obviously, living the daily life of a family caregiver, caring for somebody with dementia. I mean, you lived it, you experienced it, and so I guess what did you see just in the systems that you experienced, or the guidance that you've received as in the moment of your caregiving that needed to change, that you needed to create this new system?
Well, the most important thing, I think, is that when I started back in 1999 and 2000, people thought that people with dementia were not very bright and there was something wrong with them, and it was an illness instead of a condition. And so I saw a lot of puzzled look, people not understanding. I saw a lot of redirecting by caregivers that is exhausting, that's very offensive and not respectful to the person receiving the redirection. And I said, there has to be some other way. Unless you know that person very well, you miss a lot of cues and opportunities to clarify things and to make their life a lot better, a lot better. And so in the creating the psychology of the dementia brain, I say that the person living with dementia then becomes a participant in their care instead of an observer. You can literally reset the brain.
Conversation in just a minute, but I want to let folks know who may have just joined us. You're listening to the award-winning Caregiver SOS On Air, our program available on podcast wherever you listen to your podcast. And we're also on the radio in several stations in Texas and Florida as well. I'm Ron Aaron, along with our co-host today, Tina Smith, Carol Zernial, on special assignment. And we're talking with Dr. Ethelle Lorde about communications and people with dementia. And I saw on the internet several questions that you deal with, Dr. Lorde. Let's start with number one. What, in your opinion, can caregivers do to support seniors with dementia?
Repeat that question, please.
What, in your opinion, can caregivers do to support seniors with dementia?
I think you're asking me, what do they need to support?
Yes, well,
with dementia?
Yeah, how do you help and support those seniors?
Yes, well,
how to communicate with them?
Yes, well, to really support anyone with dementia, whether they're young or old, because now we know they can be in their teens and be diagnosed with dementia, you have to learn how to do it, how to provide. You have to have the good education. A basic education, first of all, I say communication is number one, because that's going to be your biggest challenge. Number two is what happens with the different classifications of dementia and how long my day lasts. What do you do when they're no longer verbal? Like my husband was no longer verbal for years. What do you do? So they need to know what to do. There's not enough training today for most people that are in dementia care. Nurses, doctors, frontline workers, they all need that training.
So how did you communicate with a non-verbal husband?
I communicated because I knew him very well. I knew what his life purpose was. I knew what his deepest desires were. I knew what the favorite music was. I knew he loved me. And all this came together, and he had, for 21 years, a fairly good life until COVID came along, and that's what killed him. So not the COVID, but just being lonely and isolated.
So when you talk about helping that person with dementia, one of the things you talk about is keeping a routine, like dressing, bathing, eating, appointments, keeping a calendar or a notebook. How does that help?
Well, it helps both because it's almost like your cellular system learns that you get up at a certain time, you go to bed at a certain time. I remember the old farmers, for example, they went to bed at sunset and they got up at sunrise. There was no question about it. So I think the body gets to learn that. And then it's much easier also for the caregiver because they know what's ahead of them and they just follow that routine.
And when you look at the kind of activities that the patient might enjoy, you try to do those?
Yes, activities are very important and they should be related to the experience of that person. For example, you yourself, you're a radio person. If you have dementia, I would set you up with a loudspeaker or something that looked like a radio. And I'd say, these people are here to be interviewed. Go ahead. And so these things are really ingrained in you. So you look for something. My husband was a business person, a business professor. And I would take change and put it in front of him, mix it all up and say, we need to separate that and count how much we have here. And he liked to play cards because that had to do with numbers. So you do things that are really good that helps to slow down the progression, but improve the quality of life.
So you use this theory both with family caregivers and professionals, correct?
Yes, absolutely. So now in the professionals, I created the transactional dementia intelligence model, which is for professionals and for organizations. And that's also the same pattern that we follow.
So how do you, for the professionals, how do you get them to get that connection? Obviously, a spouse would have a deep connection, or an adult child to their parent would have a deep connection. How do you establish, or how do you train the professionals to get that connection?
Well, you don't train them as much as you get that information for them. Get that from the family and list everything that they used to do, what they liked, what they didn't like so much, even when it comes to food or snacks. Everything should be listed, music, because that person is still there. They can't tell you. They can't tell you what they want, but you need to look at that resource and say, for a professional, and say, oh, he would like to be a radio person. Let's set him up.
I like that. Speaking of radio, we need to do a little business, so stick with me. We're talking with Dr. Ethelle Lorde, and we're talking about communicating and how to make life better for both the dementia patient and for you as a caregiver. Tina Smith, our co-host today. I'm Ron Aaron. Thanks for joining us on the award-winning Caregiver SOS On Air.
Well, thank you so much for listening to Caregiver SOS On Air. We're delighted to have you with us. We come to you every week with a discussion of an issue, a problem, some accomplishments involved in caregiving with more than 60 million caregivers across this country, but most thinking they are the Lone Rangers. We try to bring you the latest information and help that can make that job easier and more manageable. Caregiver SOS On Air takes a look at trends across this country. We provide tips on how to be a better caregiver, and most importantly, where you can go for help. On Caregiver SOS On Air, we try to give you what you need to make that caregiving manageable and to provide you with the help that can make your life easier. I'm Ron Aaron. Carol Zernial and I are delighted to co-host this program, and we're thrilled you've joined us on the award-winning Caregiver SOS On Air podcasts available everywhere, brought to you by WellMed Charitable Foundation.
Hello, friend. Hello, friend. Really good to see you once again. Hello, friend. Hello, friend. Really good to see you once again.
Well, thank you for sticking with us on Caregiver SOS On Air. While I talk, Tina, you take over.
Oh, well, we've been talking to Dr. Lorde, and she was telling us about the professional training that she was doing. So, you also mentioned earlier about redirection. And I remember my early days. I worked in a nursing home doing activities early on, and that was a thing. That's a thing that we were taught. We learned about. I guess talk a little bit about what redirection is, maybe why it's not the ideal, and how do you better communicate with someone rather than redirecting them to a different activity.
Yes, excuse me. It's not only not ideal, it's disrespectful, not acceptable, and very exhausting for the person doing the redirection because they're hoping something will stick. They even have to lie to people. So the psychology of the dementia brain requires that you are authentic. There's no redirecting. You're honest with the person. They trust you because they're still a human being. They're still a full human being, except they can't not receive new information and don't know what to do with it. So in the moment when you can reset their brain, they will actually give you their hand and follow you. Let me give you an example. In Ohio, I was talking to a woman whose husband every day got up and said, "We're not married. You shouldn't be here. You've been here too long. You've got to leave. Leave today." And that was a daily occurrence. And he was going up and down the hall saying that. And I said, "Could I speak with your husband? Could I meet him?" She said, "Yes." He came on and he took whatever she had, a pad or a telephone, so he could see me. I could see him. And of course, I validated that was a very particular position, or expensive for him and annoying that she was still there, and agreed with him. Once I agreed with him, his energy went down. He accepted that, and I applied the theory of to reset his brain. And I simply called him by his name and said, "Listen to me. I need your help. We need to right now slow down and let your wife rest, because she has a bad heart. She had been to the hospital. It was really annoying to her." She reported that for an entire week after his brain was reset, he sat in his recliner and he was very relaxed, and he never asked her to leave. So that was really important. And I think we can do that. I don't know for how long for everybody. Everybody's different, right? I had another man in the Netherlands who had MS and dementia, very intelligent as an engineer, trained as an engineer. Every day he fought with his wife. She did that for 4 years, home care, and she was beside herself crying. And I taught her the theory. She applied it. 2 days later, she called me with a smile on her face, and she said, "You are an angel. Today we were cooking dinner together. He was whistling and I was singing."
That's great. That's great. So can you, I guess, share a little bit about what the theory is, what the process is that caregivers need to be aware of?
Yes, they really need to take the course to understand it better, but this simply is to bring that person in an okay position where they feel they welcome you, they trust you, you trust them, and you also welcome them. And at that point, they hear everything that you say, and it does make sense to them. So it resets their brain. It's the only time that they become logical, reasonable, and rational in a long time. So it's important to be able to do that. It's a technique that's really saves time, saves money, really, because you can do more care in a faster time, because you don't have to come up with redirecting, as you just named it. And that used to be the way that people were taught, and is still being taught in a lot of programs, which needs to stop because it's not working. It's very, very detrimental to everyone.
Now, one of the things that leads into this is another question you deal with on the internet. Do dementia patients need to make specific lifestyle changes to minimize the impact? Do they need to change what they're doing, why they're doing it, how they're doing it?
You mean the person that's diagnosed with dementia?
Yes, and the caregiver.
Yes, well, it depends on what type of dementia it is and how advanced it is. Some people still can work, and even after diagnosis, because they're, for a number of hours, perhaps during the day, they're very, very much sharp, and you don't see any. You wouldn't think that they have dementia. Maybe they work a little slower, but usually at night, just like you and I, we get fatigued, and we want to slow down and sit down and have a hot chocolate or a cup of tea or something to relax. They do the same thing, except that they lose control of their behavior at that time because their brain is not, when I talked about logic and reasonable, they're no longer so logical or reasonable to control that. So the caregiver then has to know what to do to slow it down. You can avoid that hard time at the end of the day by putting more light, by knowing the psychology of the dementia brain. Reset their brain right there, and maybe play some music that they like. Music is the last thing to leave the body because it's stored at the bottom of the base of the brain, so it's protected.
And one of the things you write about is perhaps changing what you're eating, making better food choices. And for the dementia patient who is used to having that dry martini every night, do you recommend that that be switched with non-alcoholic beverages?
Well, slowly change it if you can. And if it's not detected, that's okay. And if the person is very old, look, at the end of life, I wouldn't say stop the drinks because, it's probably the only thing that they really enjoy. So you want to leave that. A lot of the dementia we know now is environmental. Too many medication, prescription medication over a long period of time, statin drugs, things like that. They really cause the brain to change and certain areas of the brain to stop working because now the drug is controlling it. Eventually, it's just like us, it becomes lazy. So it says, I don't need to do that function. Somebody else is doing it, and then it stops completely. And hold and behold, they have dementia.
Well, that's good news. You can continue with that martini.
It's always good news for some, for sure. So if you were to go back to your active caregiving days, what would you have wished somebody would have told you? Now, knowing what you know now, what would you go back and advise yourself or caregivers who are just starting this journey?
I think it should be care without walls, as they have in Canada. They have nursing homes without walls, which means somebody is coming to your home and helping you and providing company. The lack of information at the beginning when I was starting in 1999 and 2000 was atrocious, and some of the information was was not good. So I think that if there was more acceptance in society and people, we could create that kind of system where we would go home to homes and help those people. It would be a better time for everybody. I know people that actually committed suicide. I know people that killed and then committed suicide after. So it's very tragic. It's very serious. It can get to be pretty nasty.
It is. It's a tough disease. I heard someone relate it to, like, back in the 1950s, cancer was not something that was talked about. It was the C word. My great-grandmother, family rumor is that she passed away with cancer, but no one knows for sure. Well, dementia is like that today. There's still such a stigma. So to get to that point, I think it is important. I think we need to break down those walls and break down the stigma. Absolutely.
Yes, and
I want to ask you something about 3 points that you make in the information I found. One is in communicating with that dementia patient, don't ask questions, learn from them. They're the experts on their condition, and always agree with everything they say. Never interrupt them.
That's correct, because it's that's the very, very simple guidelines that everybody needs to follow. That's almost like speaking English or speaking French or speaking Italian. You follow those lines with somebody with dementia. And the reason that you never interrupt them is because they're on a train of thought, and they could very, very easily disrupt that thought. And then you're asking for that person to become anxious because now they just realized, I can't remember anything. So you have to not stop, agree with them. Like I did with that person in the Midwest. I agreed that his wife had been there long enough, that maybe she needed to leave. I understood that he was angry about that because that's what he believes, and that's okay. That's what he found in his brain. And when I teach the psychology of the dementia brain, you know exactly where that comes from because I'll show you. And that's why you don't disrupt that. You don't poke at it.
And let them guide you in what you say and do.
Repeat that.
Let the patient guide you in how you respond.
You always learn to follow before you take the lead. Always follow before you take the lead.
Now, if folks want more information from you, is there a website they can go to?
Yes, www.icacares.com or .ca.
I love it. I really appreciate you being with us, joining us today on Caregiver SOS On Air. For Tina Smith, I'm Ron Aaron, and thank you to Dr. Ethelle Lorde. Thank you. Appreciate it. You have a great day.
Thank you.
The executive producer for Caregiver SOS On Air is Daniel Calderon. The producer is Sharice Pendleton. And the associate producer is Catherine Oglesby. We'll see you next week on Caregiver SOS On Air.
You've been listening to Caregiver SOS On Air, an exclusive presentation of the WellMed Charitable Foundation. We welcome emails with suggestions and comments on this program at radio@wellmed.net. Join co-hosts Carol Zernial and Ron Aaron next week for more on caregiving, improving the health and well-being of caregivers and their care recipients everywhere. For more on caregiving and podcasts of our programs, visit caregiversos.org.